Hello, and welcome to this presentation on speech and language impairment by Emily Green, Elizabeth Holmes, Rebecca Barton, and Autumn Dow. Okay, so starting off with speech impairment. Speech is disordered when it strays so far from normal speech that it calls attention to itself, hinders communication, or causes distress to the speaker and or the listeners. And three types of speech impairments are articulation, voice, and fluency. Articulation is the difficulty pronouncing sounds correctly at the developmentally appropriate age. So if a child is not pronouncing sounds correctly at the age that most children can, they may have a articulation impairment. And then voice is abnormal production of voice quality, pitch, loudness, resonance, or duration. And fluency is impaired rate and rhythm of speech, and stuttering is an example of this. There are several possible causes for speech impairment. Some of them are vocal cord damage, brain damage, muscle weakness, respiratory weakness, strokes, and then people with other medical or developmental conditions may have speech disorders. So like someone with autism may also have a speech disorder, and then they can also be hereditary. Some symptoms of speech impairment or ways that you can identify a speech impairment are repeating sounds, adding extra words and sounds, elongating words, making jerky movements while talking, visible frustration while talking, taking frequent pauses, or hoarseness or raspiness in their voice. And then the sooner a speech impairment can be diagnosed and treated, the more likely it is for a child to eventually outgrow the disability or at least prevent it from worsening. And because it can be frustrating for someone to not be able to express what they're thinking, it can lead to both social and emotional problems as well.
So what can we do to help students with speech impairments? One of the best things that we can do is to make sure that they have opportunities to have regular conversations and create situations that are natural for them to practice their language skills, whether that is with us or with children their own age. We should constantly be checking for understanding to make sure that the child knows that we're here to help them. Another thing that could be helpful is role playing. Role playing is something that the child can do with us and feel that they're in a comfortable situation to practice their speech. The next thing that we could do is ensure that all students know that their verbal contributions are equivalent to one another and are encouraged. We want the students to all feel that regardless of their speech impairments, that they have a contribution to make and that there is always room for improvement for everybody. The next thing that we could do is to ensure that we're using all the means necessary to create a healthy life for them, which includes using their IEP and constantly checking with the other people on their IEP team to update it and to ensure that all accommodations are being met. Communicating with parents is also another really big thing. We want to make sure that the parents are always in the know. And some other small things that we might be able to do are facilitate radio and television or broadcasting opportunities so that the child can hear normal speech more frequently. We might give them opportunities to talk on the telephone or to tell us jokes or riddles or give book reports.
Okay, so language impairment. First, you have to understand what language is. So language is a system of symbols that we use to communicate feelings through thoughts, desires, and actions. This is usually through speaking or examples like sign language or reading. Um, there are two different kinds of language problems. There's receptive language, which is understanding what people mean when they speak to you. And then there's expressive language, which is speaking or writing in a way that others understand you. So here are some of the common signs of receptive language problems. I'm not going to read all of them to you, but we'll talk about a few of them. So things like they have difficulty following oral directions. They don't understand what you're saying when you're talking to them. They can't detect where their breakdowns in communication are happening. They have difficulty understanding humor or sarcasm. Um, they miss parts of material presented verbally, particularly less concrete words such as articles and auxiliary verbs and tense markers. So they don't understand the difference between he was in class and he is in class. They have a hard time comprehending concepts like comparative size, time, space, relationships, function, and they will often confuse the sound of letters that are similar or reverse the order of syllables in words. So, for example, they might hear the word was, but think it's the word saw because they reverse the syllables. Okay, so now we have signs of expressive language problems. So this includes things like using incorrect grammar. They're afraid to ask questions because they don't know what to ask or how to ask it. They repeat the same information over and over and over again in conversation. They will have trouble finding the correct word for communicating. This is called word finding. They have limited use of vocabulary and they'll often jump from topic to topic. They will also say a lot because they hesitate. Okay, so some of the most common examples of language disorders that people have heard of are things like aphasia, which is the loss of ability to understand or express speech caused by brain damage. You see this a lot in students writing. And then also dyslexia, which is a general term for several disorders that involve difficulty in learning to read or interpret words, letters, and other symbols, but that do not affect general intelligence. So when the words seem to float around or the letters float around and change what order they're in and things like that. So
When working with students that have receptive language disorders, explicitly teach them to listen with directions such as full body listeners are facing the speaker, eyes are on the speaker, and our hands are free of distractions. Teachers should also highlight meaningful listening moments by saying, "Class, we will now listen for directions," or "Let's show our classmate we are listening." While speaking, teachers can also give visual cues by pointing to a picture or cupping their hand behind their ears. Having a read aloud in class can also create meaningful listening experiences. When working with students that have expressive language disorders, give them meaningful practice experiences, such as have them tell a story from the weekend or a favorite part in a book or movie. When students are talking to you, be sure to give them extra time to think, and afterwards praise their attempts. After a student is done speaking, you can either model the correct way or add more information. Also, as you do read alouds in class, you can ask the students for important details that were shared or to summarize what was read. Lastly, and the most important thing to be aware of when working with students with language or speech disabilities, is that we should be encouraging and create an inclusive classroom where they feel comfortable in practicing.